Bismillah ar-Rahman ar-Rahim. Dear colleagues and PGs, 3 weeks ago, on 24th June, American Association for Study of Liver Disease has introduced new terminology for fatty liver disease. Today we shall discuss what is this new terminology and how is it different from the existing terminology for fatty liver disease. So as I said, topic for today's discussion is new terminology for fatty liver disease. On June 24th, 2023, that is around 3 weeks ago, AASLD published a new fatty liver disease nomenclature in their special article entitled A Multi-Society Delphi Consensus Statement on New Fatty Liver Disease Nomenclature. Huge number of authors and more than 67 societies across the world has endorsed these. The AASLD, the ECG, EASL, ASG, ISGAFAN, and so many. This is the list of those societies which have endorsed this new terminology. We know that we used to call the fatty liver disease, and it was classified into two according to the alcohol intake, either the non-alcoholic fatty liver disease or alcoholic fatty liver disease. So basically, fatty liver disease used to be of two types: non-alcoholic fatty liver disease and alcoholic fatty liver disease. And then the non-alcoholic fatty liver disease was the fatty liver, NASH, non-alcoholic steatohepatitis, and then cirrhosis, depending upon the severity of the disease. But now, according to this new nomenclature, the fatty liver disease is entitled as steatotic liver disease. And according to the alcohol, no, there are two clear types: the metabolic dysfunction associated steatotic liver disease, MASLD. M stands for metabolic dysfunction associated steatotic liver disease and alcoholic liver disease. And in between, when both the components of metabolic syndrome as well as the alcohol is there, no, there's third category has been introduced, and this is called metabolic dissociation alcoholic liver disease. And then the metabolic dysfunction associated liver disease is further divided into three, depending upon the severity of the disease. The fatty liver is now called steatotic liver. The NASH is called now metabolic dysfunction associated steatotic hepatitis, and cirrhosis is cirrhosis. Let's go into the more detail of that. The steatotic liver disease, number one, is the metabolic dysfunction associated steatotic liver disease or MASLD. And then there is the alcohol associated or alcohol related liver disease, that is the ALD. And then the third category, that is the specific etiology of steatotic liver disease, like drug-induced liver injury, DILI, or monogenic diseases, are miscellaneous. The monogenic diseases include lysosomal acid lipase deficiency, LALD, Wilson disease, hypobeta lipoproteinemia, and inborn errors of metabolism. While the miscellaneous causes for the specific etiologies steatotic liver disease is hepatitis C virus, malnutrition, and celiac disease. This is important because this type of steatotic liver disease will respond to the treatment of the underlying cause. Then this is interestingly the in between the metabolic dysfunction associated steatotic liver disease and alcohol associated liver disease. In between, they have introduced an intermediate category or the third category that is called MASLD or metabolic dysfunction alcoholic liver disease. Depending upon the predominant features like predominant MASLD and predominant ALD, when weekly intake of alcohol is 140 in male or 210 in female, that is the gram, this will be called predominantly MASLD. But if the alcohol is more, 350 gram per week in male or 420 in female, this will be predominant alcoholic liver disease, but both components will be present. On daily basis, if the alcohol intake is 20 or 30 and 50 or 60, then this will be predominantly MASLD or predominantly ALD. So this is the new category which they have introduced in the steatotic liver disease. So basically there are 5 types: MASLD or metabolic dysfunction associated steatotic liver disease, then metabolic alcoholic liver disease, and then alcoholic liver disease, Haverly, and then specific etiology, specific liver disease, steatotic liver disease, and cryptogenic steatotic liver disease. And then this metabolic alcoholic liver disease is further divided into 3: predominantly metabolic associated liver disease, predominantly alcoholic related liver disease, and in between. So this is how they have given the new terminology depending upon the etiology as well as their line of action, line of treatment. So what's the algorithm? If the patient has got steatotic liver disease, either diagnosed on hepatic steatosis is identified by imaging like ultrasound or MR or biopsy. So the next question will be asked, does the patient meet any of the cardiometabolic criteria? If yes, the patient has got cardiometabolic criteria, are there any other causes of steatosis? This will be next question. If patient has got steatotic liver disease and patient meet criteria of the cardiometabolic syndrome and there is no other cause for steatosis, this will be diagnosed as metabolic dysfunction associated steatotic liver disease or MASLD. If a patient with steatotic liver disease meets criteria of cardiometabolic syndrome and there is other cause of steatosis, then this will be either metabolic alcoholic liver disease or other combination etiology. If the patient with steatotic liver disease does not meet any of the cardiometabolic criteria, the next question will be, are there any other causes of steatosis? If yes, then these can be specific etiologies steatotic liver disease like alcoholic liver disease, drug-induced liver injury, or monogenic diseases, which I discussed with you in the previous slide. But if the patient has got steatotic liver disease, does not meet any criteria of the cardiometabolic syndrome, and there is no other cause for steatosis, then this will be diagnosed as cryptogenic steatotic liver disease. So, what is the cardiometabolic criteria which, if present with the steatotic liver disease or the fatty liver, we will say that this is the metabolic dysfunction associated liver disease or MASLD. This is the standard 5 components of the criteria for metabolic syndrome. In the absence of the fatty liver or steatotic liver disease, you need 3 out of 5 to diagnose a patient having cardiometabolic syndrome or metabolic syndrome. But if the patient has got fatty liver or steatotic liver disease, you need only 1 out of these 5. What is this? First is the BMI or waist circumference. Second is the presence or absence of diabetes. Third is the presence or absence of hypertension. Fourth is the high triglyceride level. And 5 is the low HDL cholesterol. The first criteria, if patient has got fatty liver or steatotic liver disease and his BMI is more than 25 kg, 23 in Asia. In Asia, this is taken 23. Outside is the 25. The patient has got 1 criteria and will be labeled as metabolic dysfunction associated liver disease. Or the patient waist circumference is more than 40 inches in male, but in Asia this is 34 inches, and 35 inches in female. In Asia this is 32 inches. So if the waist circumference is more than 34 or 32 inches here in Asia, or if the BMI is more than 23, in the presence of the fatty liver, it will be a case of metabolic dysfunction associated liver disease. The second criteria, diabetes. If the patient fasting blood sugar is more than 100 milligram, or 2-hour postprandial sugar is more than 140 milligram, or HbA1c is more than 5.7, or the patient is on treatment for diabetes, and that patient has got fatty liver disease or steatotic liver disease, we will diagnose metabolic dysfunction steatotic liver disease MASLD. Regarding hypertension, if the blood pressure is more than 130 by 85 millimeter, or if the patient is on treatment for hypertension, again, only this 1 criteria is sufficient in the presence of the fatty liver or steatotic liver disease to diagnose metabolic dysfunction associated steatotic liver disease. If the fasting triglycerides is more than 150, or if the patient is on treatment, again, presence of this only one criteria along with the fatty liver will be a diagnosis of MASLD. If the HDL is less than 40 milligram in male or 50 milligram in female, or the patient is on treatment for this, again, in combination with fatty liver, this is the diagnosis of MASLD. So, without fatty liver, or when there is no fatty liver, no liver steatosis, you need 3 out of 5 to diagnose the metabolic syndrome or cardiometabolic syndrome. But if there is fatty liver or steatotic liver disease, you need any one of these 5 and the diagnosis will be MASLD, metabolic dysfunction associated steatotic liver disease. So thank you very much, dear colleagues. This was the new criteria, new terminology, which was introduced by the AASLD on 24th June 2023. And around all the world, all the societies in the world have endorsed this. So I wanted to share with you, because now the articles, the papers, which will be being published, or discussions will be done, they will be using this terminology. So to avoid any confusion and to know why this new terminology has been introduced, I wanted to share with you this very much update in the field of hepatology and in the field of fatty liver disease. Thank you very much. I stop here and meet in another lecture soon. Thank you.
Bismillah ar-Rahman ar-Rahim. Dear colleagues, just few hours ago, I posted my video lecture on new nomenclature of fatty liver disease. As mentioned in that video, the terminology and diagnostic criteria for fatty liver disease has been updated recently. Steatotic liver disease has been chosen as an overarching term to encompass the various etiologies of steatosis. The term steatohepatitis is felt to be an important pathophysiological concept and therefore has been retained. Non-alcoholic fatty liver disease, NAFLD, is now termed as metabolic dysfunction associated steatotic liver disease, MASLD. MASLD encompasses patients who have hepatic steatosis and have at least one of the 5 cardiometabolic risk factors. A new category outside pure MASLD, termed MetALD, has been selected to describe patients with MASLD who consume greater amounts of alcohol per week. Metabolic dysfunction associated steatohepatitis is the replacement term for NASH. Those with no metabolic parameters and no known cause have cryptogenic steatotic liver disease. While describing the amount of alcohol intake, I uttered the reversed values for males and females. My friend, Professor Zafar Sahib from Lahore, has rightly pointed out this mistake of utterance, so I hereby correct my wrongly spoken figures. as shown in the slide of my lecture in that video, and now showing this slide again here. Alcohol intake value for females in MASLD is 140 to 350 gram per week or 20 to 50 grams per day. For male, this value is 210 to 420 gram per week or 30 to 60 gram per day. I repeat, for females, it is 140 to 350 gram per week or 20 to 50 gram per day. For male, this value is 210 to 420 gram per week or 30 to 60 gram per day. Minimal value represents MASLD-predominant and maximum value represents ALD-predominant. I hope this follow-up video corrects my unintentional mistake in uttering reversed values of average alcohol intake for females and males. I am really thankful to my friend Professor Zafar Sahib from Lahore for helping me out to rectify my mistake. So for MASLD, the average alcohol intake for female is 140 to 350 gram per week or 20 to 50 gram per day. For male, this value is 210 to 420 gram per week or 30 to 60 gram per day. And thus, in that video, these values should be taken as corrected like this. Thank you very much.